My name is Amanda Anello, and I'm the Health Services Administrator here at Siyan Clinical.
Hi everyone, my name is Thomas O'Donnell and I'm a substance use disorder counselor here at Siyan.
And today we're going to talk about what mental health means to us and why it's so important in our community. Thomas, tell us a little bit of why mental health is important to you.
So mental health, when I hear the word mental health, I think about mental wellness, and we want to think about the person as a whole person, all the aspects that make us up as an individual person. And at Siyan Clinical, we always promote positive outcomes for mental health. That's one of our primary goals here at Siyan. And we want to just open up the dialogue box and the conversation about what it is to have positive mental health and self-care for each individual we serve here at Siyan Clinical.
Yeah, and I think I agree with you. Just like we have a physical health, everybody has a mental health, and I think it's really important that when someone's struggling or when someone is having a hard time with their mental health, that they reach out and they ask.
Hi, my name is Charlotte Van Oppen. I'm a case manager at Siyan, and seeking help for mental health really matters because sometimes we can feel alone in some of our struggles. So seeking out people who can listen or support that or provide help may be really beneficial for individuals.
Hello, I'm Dr. Kritika Chokawala, a psychiatrist here at Siyan Clinical. Mental health matters because it affects every aspect of our lives. Our emotions, our thoughts, our behaviors. It shapes how we cope with stress, relate to others, and make choices. It is also universal, impacting everyone regardless of their background. You may seek a psychiatrist for assistance in dealing with anxiety, depression, trauma, substance dependence, or stress related to daily life changes. We at Siyan Clinical are dedicated in fostering mental health well-being through inclusive and culturally competent healthcare. It is essential to recognize that our diverse experiences shape how we perceive and manage mental health challenges. By providing personalized and tailored treatment plans, which include psychotherapy, medication management, medication-assisted therapy for substance dependence, or novel treatments like nasal ketamine and transmagnetic stimulation, we ensure that we respect your cultural and personal identity. Remember, seeking care is a sign of strength.
I'm Anisha. I'm a psychiatrist and CEO of Siyan Clinical. On Mental Health Awareness Month, I want to emphasize 3 key points: importance of mental health illness, the barriers we face, and the steps we all can do to improve and promote mental health awareness and care. Mental health affects every aspect of our life. It influences how we think, how we act, how we relate to others, and how we make choices in our life. Mental health issues are common in all age, gender, socio-economic status, and also in all races. 1 in 5 US individual adults experience mental illness every year. Suicide is the second leading cause of death amongst 10 to 14 and 25 to 34 year age group in the United States. Despite of prevalence of mental health issues, there are significant barriers that prevent individuals from seeking help. Number 1, stigma, discrimination, and misconception about mental health can lead to shame and isolations, and that makes people harder to acknowledge their struggle and seek assistance. Many people lack adequate access to mental health services because of lack of insurance or limited availability of mental health professional, and at times because of the geographic location. In addition, there is often a lack of understanding about mental health services and how best to navigate the system. We can take several steps to continue improve mental health awareness and care. Number 1, we must continue to educate ourselves and others about what mental health issues are and try to dispel any myth, stigma, and also promote empathy. School, workplace, and community organization has pivotal role in educating about mental health issues and care. Second, we must advocate for better access to mental health care, and this can be done by promoting and supporting policies to improve mental health services and also to train more mental health professionals. And the third important thing is to integrate mental health care in primary care setting. Third, we must foster culture of openness and support in communication about mental health issue at home, workplace, and also in communities by creating safe space where individuals feel comfortable sharing their experience and also without any worry about fear of judgment. Finally, self-care and early interventions are crucial. We must encourage regular physical activities, healthy eating, adequate sleep, and mindfulness. Recognizing the early sign of mental health issues and seeking help promptly can prevent more severe illness or problems. At the end, let us work together to promote mental health awareness and ensure that everyone has the opportunity to lead healthy and full.
Hi everyone, my name is Tiffany Morgan and I'm a project and grant manager with Siyan Clinical. Today I am addressing the question, why does mental health matter? I feel like mental health, just like physical or spiritual health, is a basic tenet to our existence as humans. It is something that we can easily take for granted in good times and struggle with severely in bad times. I am a big fan of psychoeducation. I believe it is sorely lacking in our public education system and could solve so many societal problems and vastly improve countless lives. Psychoeducation is important in many ways. It gives us the awareness we need to identify mental health struggles not only in ourselves but also in others. It is also important because the knowledge provides us with some basic tools to manage mental health on a daily basis or to know when to seek help. The saying, an ounce of prevention is worth a pound of cure, is especially true in terms of mental health. Please be kind to yourselves and each other.
Hi there, my name is Jessica Schmidt and I'm a psychiatric nurse practitioner. We're just thinking about mental health, and I think it's really important to consider mental health because it basically impacts, everything with a person. It affects your health, and if you're struggling with mental illness, it really affects any aspect of your life, including your relationships, your work, if you go to school, your health, your sleep, and your ability to take care of others. I think it's really important to seek help if you are experiencing mental illness or any symptoms, because it's not necessarily something that's going to go away on its own, and it can even get worse over time, even leading to the point where it affects your functioning. I think it's also something that's very treatable, and it doesn't necessarily have to be just medications or therapy. There's lots of different things out there that can help mental illness, and I think a good provider can find a treatment plan that fits your needs, and that's sustainable for you. I think it's really important to include everyone in mental health care. I think that there's lots of resources out there for people, and it's really, the first step is really about directing people to the appropriate resource, whether that's education or offices where they can see a provider or therapists. There is a lot of services out there for folks. It's just kind of about finding them and finding like what your insurance takes and or doesn't take, and finding what can be helpful for your treatment. I mean, at the end of the day, like, no matter what you look like or how much money you make, everyone is susceptible to mental illness. So, it's not just one particular group, and I think that care should be available for everyone.